Good evening to my guest, Tina Wright, who I'm going to introduce in a minute. Good evening to me. We're on the same side of the globe. My guest works and lives in England, and I'm streaming live from Israel. My name is Dr. Tovah Goldfein. This is TMS Roundtable. We have been consistent weekly, repetition every week for now about 4 to 5 years, going on 5 years this coming March. I started with my co-host and very close friend, Rose Hoye, who has passed to the next world. So in her honor, we continue the healing. We continue understanding that we are our own medicine. We are our own doctors. And every week, in honor of Rose and in honor of your healing, we will speak to you, we will educate you, we will inspire you, we will ask you to come and speak and interact and talk with us, either here in the live studio or from the YouTube. Let me just stop there. I get real excited. So Tina and I met, well, first of all, I'm a little bit of a magnet to let me just put up your name, a little bit of magnet to like anything about IBS, because it's my sensitive organ. It's my sensitive organ. And I think it's a lot of sensitive organs. I think the stomach, the colon, because the connection to the brain, as well as it's such an expression, our colon and our stomach, of who we are, as children, adults. It's a place deeply in our chi, in our center, in our solar plexus, where it's energetic. I'm sure there's all these different explanations about the colon. And but so I'm always attracted to that when I see that with other coaches. And then when I met Tina, you have a story, you have a healing story. And so it just makes it even more profound that you're helping others because you've experienced what they've experienced. So you have the empathy, you have the knowledge, and you're in recovery. It doesn't mean you're cured. I believe God cures, but you are in recovery and you are resilient. You fall and get up and fall and get up. We fall 8 times and get up 9. That's part of this game called life. So I'm going to zip my mouth. I'm going to relax and breathe. Tina, you're a psychotherapist. You're also an IBS specialist. You're also a cognitive behavior therapist. You work for the NIH in England. You're now working
NHS.
NHS. Yeah. And you're going to talk, and I'm going to listen because I'm very excited to hear from you. And how I would love our listeners. I kind of have them trained to hear kind of like a timeline of like how this all happened, to give us, the details and the story of what brought you from being sick to getting well, from, illness to recovery. And now you're helping others. So welcome to my safe and authentic studio.
Oh, thank you so much, Tovah. It's so lovely to be here. It's an honor. I heard about you actually a number of years ago. I think it was probably via Georgie, Oldfield from Serpa. And yeah, it was one of my, on my little list of got to meet.
Yeah, there we are.
Yeah, so it's real honor to be here. And thank you. Thank you for the opportunity to chat and just share, this information, because it is still a lot of it isn't out there. There's a lot of misinformation, and we've got to work even harder to overcome that. So, yeah, as we talked again last week, was it? And realised just how long the story is, and it is lifelong. So, do you want me to jump in?
Well, I want people to know. I'd like people to know, your childhood and how you dragged, the ball and chain, and how you into when you got married and had a child and were working full time, and kept realizing this and this, and then started to privately help people. So kind of give us the main points that, and keep in mind that just like your situation, and you and I spoke about this, everybody, heals so differently. So your story is your story, my story is my story, but we're human beings. So we have enough in common: compassion, we have gratitude, we have a nervous system, we have a brain, and this is where we can all heal. This is where we're all capable of healing. And go ahead, start from there.
Okay, so I always think of my story starting before birth, because my parents were very anxious. Both of them had troubled upbringings and difficulties, brought up with parents that had been in the Second World War, so there was a lot of angst in the family. And when I look back now, I can see, there's quite a bit of dysfunction going on there as well. However, they were doing the best they could, as we all do. And they got married really young. My mum was only 16 and fell pregnant with me within a couple of years. But they moved to a small village, and the transport links weren't very often. There was a bus, and I think it was daily, one in, one out. And there was there was a train station, but again, very irregular, and they couldn't afford a car. So it was really, like isolating.
Yeah.
So when my mum was pregnant, I think she was just extremely anxious. Towards the end of the pregnancy, she then became really ill with preeclampsia. And I was born at term, but my mum was taken into ITU and I was taken to baby care, or special baby care, straight away, because as soon as I was laid on her chest to feed, I started having a fit and my mum almost passed out.
Wow.
So we were separated, and were separated for a couple of weeks. Now, when you think about the gut microbiome, as my story is all about the gut, it's not all about the gut, but the main story is the gut. When we're separated from our maternal or our caregivers, we know from ACE studies, that is a huge stressor on the child or the baby. You add to that I hadn't had any breast milk, and we know now for the microbiome that can help, introduce a lot more of the good bacteria at an early age. I'm then in an incubator, tube fed, and it's extremely clean. You don't get any of those microbes that you would in a normal environment. When I go home, my parents, caring as they were rather overcompensating for me being, so small and so vulnerable as they saw, which was the message I got.
And it was scary. It was you were this little baby.
For all of
scary
us.
For them.
Yeah, they were scared. I was scared, but obviously I didn't know it, and they didn't really recognise it either. They were just getting on with the life, and I was thinking, that we were all quite vulnerable in that time. But we got through as best we could. My sister was born a couple of years later, and then a brother a few years after that. But whilst I was at school, I often had stomach aches, problems with, getting every gut issue that went around, so often having time off with GMV. But it was often, sort of put down to, it's just a childhood illness. But I'd get them all, and it wouldn't always be when it's going around the school. I'd seem to be unwell anyway. So eventually, I think I was in my early teens, I was taken to the doctor to see about these stomach issues, that were causing such a big problem. It was, I weren't having time off school, because that's not what my parents were about. They wanted me to have an education, but there were days where I'd be crying with pain.
Wow.
So I had some investigations, and I was told it was growing pains. Then a few investigations later, told it's just lady stuff. She's of that age. And so it felt dismissive. And this went on, right through my teens and into my 20s. And in my 20s, I did go have some more investigations because it erupted again. And there was a question whether it was, maybe it was ladies' problem. Maybe there was a problem with the ovary. And I was, concerned, would that affect my ability to have children? So I did investigate. And a doctor, who was a junior doctor, a houseman at the time, just sat there, looked at me as I was going out the door and just went, "Oh, have you heard the term psychosomatic?" And I sort of looked back at him, and I don't know, what it was, but I felt in that moment that he didn't, he wasn't saying it to be helpful. It was almost, he was being dismissive. And that got me, I was like, I've had it with doctors, I've had it with professionals, they all just, say it's nothing, it's, they're just saying it's in my head, which is the classic that we often think when we've got any sort of TMS issues, isn't it? So I didn't go back to see any medical professionals for over 10 years, even though I was still having symptoms. Through my pregnancy, my bowel seemed to get a lot better, which was a real surprise to me because I was like, oh, what's going on? Why are these hormones helping? But then as soon as he was born, it was not nice. You sort of think that you're going to just be changing babies' nappies, but it felt like I needed nappies. It was really horrendous.
So it was worse. So your symptoms got worse after you delivered your child. Wow.
Yeah. In the first few months, I suffered postnatal depression. I was anxious, obviously, first child, and most people are anxious to a certain extent, but I think I was, excessively anxious. I wanted to get it all right. I wanted to make sure he had the best start in life. And again, as we do all, but it felt more than, it felt like I needed to get it exactly right, and I couldn't do it, and so I felt really low. But my stomach was the worst, it'd ever been. And at times I was going between 13 and 20 times a day.
Oh my goodness.
It was horrendous. It caused a lot of other physical issues, things that people don't always talk about.
Right.
Pregnancy itself can cause piles, hemorrhoids. I was then going to the toilet lots afterwards. So, there was not just stomach pain. It wasn't just the bloating. It wasn't just the inconvenience and the embarrassment of toileting all the time. It was then this, intimate pain underneath, and felt extremely isolated. Because a lot of my other friends that were mums had, got through the other side, and, they were enjoying time with their baby and their toddler. I found I wasn't really enjoying any of it. And, I found every day a real struggle, to be honest. So I started looking into psychological help because I had depression and anxiety, thinking, maybe that would help in some way. And I did. I embarked on I always say it was my personal journey that then became my professional journey. I went back to uni and did a degree in psychology, and then went on and did lots of other postgraduate courses in psychotherapy and CBT and all the different modalities.
I think all during your symptomatic, drama and trauma, the fact that you just kept going was something about that you were actually like in survival mode physiologically, but emotionally you were like, okay, I'm going to get up and do another day. And this is part of the healing. So I think for you, it would have been a lot worse if you didn't somehow tell your brain, okay, brain, we're going to go to the bathroom 10 times, but we're going to go to school also.
Yeah. And it was almost like I had to have that purpose. Yes, I had a big purpose of looking after my son. However, it was like this life purpose that became such a thing that gave me the drive to make sure that I was, studying the best I could, being a mum the best I could, but also being a human being, the best I could. And it was a juggle. It was a real juggle all the time. And I could notice that at times when I was facing exams, or there was an essay due in, or I was being observed with clients or whatever, they were the times my stress was highest, my symptoms were worse. I went through a period of having, extreme vomiting, which was like, where did that come from? But it was all, my whole digestive system was so dysregulated.
Wow.
And it was horrendous at times. I was in hospital a number of times on a drip, with being hydrated and having extra potassium dripped in because my heart was at risk because I was so dehydrated because I'd vomited so much. It was just like, this is ridiculous. And that actually, the worst of that was during my time as a CBT trainee, as a therapist training in the NHS. So it was so related, that there was this stress, and then the symptoms just heightened even more.
So what was the turning point? What was the turning point that brought you into the mind body? Hey, wait a minute. Let me understand something deeper going on, because obviously you weren't getting better from the medical model.
No, that's it. So there were two things, and I mentioned one to you last time we spoke, was I went online and was always online. I think I tell people now, don't Google. Dr. Google hasn't got all the answers, and where did he get his medical degree and all that sort of thing. But actually, it was through Google I found Curable. And for people that don't know, Curable are a brilliant organisation. They have an app. They have a lovely Facebook group, which is so positive. It's lovely feel in that group. And I was in the group searching through, and I saw someone saying about having one-to-one therapy and asking if there was anyone in the UK, because a lot of the people in there were from other places around the world, especially in the US. So one person suggested that this other person looked at the SERPA website. And so I checked it out and found Georgie, and I was like, this is what I need.
What an angel.
At the same time as that, I remembered when after we'd spoken, there was a book on the shelf at work that used to catch my eye, and all our books were, had mind in the title, or they had psychology or psychiatry. They were all lined up there, or CBT or behavioural. They were all there with these words that were very familiar to me. And there was just only one in all our bookshelves that had the word body in it. And that was The Body Keeps the Score. And I read that, and that's the Bessel van der Kolk. If you've not come across it, you need to read it. It was amazing. And I was just like, wow. I devoured it. And I was like, this and the Curable and, SERPA, they're all saying the same thing. And they're from different parts of the world.
You're not broken. You're not broken. And that whatever.
Wow. And there's an explanation. There's there's reasons for the flare-ups. There's reasons, and ways to recover. It's like, oh my goodness, I can heal. Amazing. And that's where, the real turning point was. I studied in SERPA course to help others, because I've always found that helps me to understand it even more.
So that's number one. Number one take-home tool is that even we're struggling, we're suffering, and so many people are, and such empathy and such compassion, but yet inspiration and education is to say, even though you're suffering, take some of that energy and help others and it will help you in any way you can, whether it's, you know, doing some volunteer work or even going to a parent or going to it. I think what we're saying is, look, if somebody's really in pain or having symptoms and they can't get out of bed, there's even, what do you think of this? You know, the quantum world is that I can just imagine myself helping others. I can just make a phone call. I can talk to a friend. And that's why some of these Facebook pages are good, because people are healing from giving, from helping. So that was number one take home.
Yeah.
That what helped you heal was that you were beginning to help others.
Beginning to help others and not feeling alone.
Or like a victim.
Yeah, or like a victim. I don't think I ever felt like a victim. You know, and I know that is you know, a place that some people can get to, but I don't think I ever really, you know, sort of felt that. I didn't want to be a victim, and I don't think I'd been, you know, sort of molded that way. I was seen as the vulnerable one, but the surviving one. So, you know, I was the one that was able to get through this. So I think that's what it was. I was seeing myself as a survivor, so I had to find a way to survive. I had to find a way of feeling safe, even though I didn't. So yeah, sharing with others, feeling not alone, and you know, enabling others to learn from your successes and mistakes. You know, sharing that. Excuse me. Sorry. Sharing that in, you know, in groups as well. You know, like, and speaking to others, saying, you know, I get it. Yeah, it's been a really hard time, you know, but there is a way through. It doesn't last. You know, it's not always going to be like this, because nothing ever lasts forever.
So you started to see a change in your symptoms throughout studying with Serpa and Incurable, and all of a sudden, like you just your colon was stronger. Like, what shifted? Like, tell me, like, what was going on in your mind? Were you understanding the deeper feelings that you were repressing, and what else was going on?
Yeah. So part of my job in the NHS was teaching meditation, mindfulness. And I took a course to teach it for others. Again, you know, part of your training is always, you know, looking at CPD, you know, continuing professional development. And that was an area that really interested me, especially because I'd known from, you know, from Georgie and from the work in Curable that it was really helpful. So I started meditating because I was going to teach it. But once I started teaching it, I realized that I was only meditating at a cognitive level. There was this thought about, I'm doing it, so I'm doing good and I'm going to get better. It wasn't done in the right. No, that's a judgment. It's not that it was wrong. It was just the way I learned was in stages. First, I had to go by rote almost. How you do when you drive. You know, when you learn to drive, you talk yourself through the steps. You know, I need to put, you know, foot on the clutch, change gear, look in the mirror. You know, you're telling yourself what you need to do. And that was how I was meditating, really. I need to sit in my place. I need to concentrate on my breathing. I need to, you know, and it was all I need to, you know, and I was still doing rather than being.
Very important point. Because we're excellent at doing. We are brilliant, and that muscle is very strong, and all of us are doing muscle. But the being muscle is part of the healing and part of where we have to work, and not so comfortable and not familiar. But so go ahead. Good. Thank you for pointing that out. Second take-home tool. Let's get, you know, better at feeling, and then we'll feel better. And getting better at feeling is being.
Yeah, and allowing that, you know, that's the thing, isn't it? And recognizing, excuse me, just that we, you aren't going to be hurt by feeling those feelings. They're uncomfortable, but they're not as scary as we think they're going to be. They're actually less hurtful than the physical pain.
Well, I'm very privileged. I study with Dr. Hanscom each week. a little coffee session with him each week, and I'm learning a lot from him. And he often says this, and I'm just a conduit. I'm just repeating what he says, and he always says, and he learns it from someone else. But hear this to the audience: the body, or the brain, is not. We're not trained, or what's the word? We don't know how. Oh, I want to say it like him. We do not know how to process emotions, or something like we don't know how to. I'll have to write it, what he said, but it's as if our brain and nervous system do not have the ability or the experience or the I'm not saying correctly on how to be emotional. Right. It's like we're very good at physical, because I think this goes back to the lizard brain. Mm-hmm. You know, the lizard brain is protecting, and then and we don't have, I have to say it correctly, we don't have the ability to be emotional. It's not the first thing. It doesn't come easy. I'll have to get that and write it now. I'm feeling a little tired, but that's okay.
See, as you know, I think I know what you mean, but as a behavioralist, I think how I would look at it is that we've learned to be a certain way. You know, we weren't necessarily born worrying about things. We weren't necessarily born not feeling our feelings, because as a child, as a baby, we're very reactional. You know, we'll cry if we're hungry. We'll show our emotion if we're angry at something. You know, someone taking a toy away, we'll be angry. Right. But we've been socialized to hide emotion. Yeah. We've been socialized to think rather than be. Right. And because our whole education system in the West especially is teaching us to think. So we get very good using the prefrontal cortex, problem solving, planning, thinking, but feeling and recognizing the emotion and connecting that with the body isn't something we're trained in. Our parents weren't trained in it, so they didn't teach us it. And so we're all learning from scratch how to actually feel our feelings. Yeah. And that is a big part of the work. And meditation started that for me. Journaling helped with it. But just being more aware of, you know, what I was feeling in each moment was a way of, you know, not then allowing it to hang around. You know, it was almost like giving it the acknowledgement, but not hanging on to it.
So what do you think was the trigger for you? What deep repressed emotion was was activating your amygdala, you know, to like put you in fight or flight since an early age? And you were just like, all right, come on, fight or flight. We're going to go to school. We're going to have a child. You're just like, and the body was constantly in a state of heightened awareness, like alert, you know, 10, 10, 10. Like what was the emotions that you realized through your work?
Yeah, there was a huge amount of fear, but there was anger underneath that fear. There was anger and rage that, you know, these medical professionals hadn't noticed it. There was annoyance, actually, you know, and I think, if I'm being totally honest, there was rage at my parents for not pushing earlier for me to get the help. There was anger at, you know, the world for not recognizing that you can recover. You know, there was loads of different things, but all of them, as we know, are in layers. But underneath a lot of that anger was also shame. Shame that I was having to go use the loo so much. Shame that my body wasn't working, or I didn't think at the time it was working as it should be. I thought there was something wrong with me as a person, as an individual. It wasn't that I'm doing something wrong. I am wrong. Wow. You know, I am wrong to be like this. Right. And that caused so much shame that I had to work through. And we know, you know, from research, you know, psychological research into PTSD and CPTSD, it's the shame that's often the thing that is, you know, when you have shame, that's the fuel for any trauma responses later on. So, that's how I visualize it is, I wouldn't say it was traumatic, but small t, chronic stress, it's there, on an ongoing basis. And it's so much so that, as soon as I started calming one symptom with all this work, up comes something else.
Wow.
And not just one, there was more and more coming, and it felt like I was collecting diagnoses day by day. But it was over a couple of years. I got diagnosed with migraines, TMJD, so temporomandibular joint dysfunction in the jaw, and then fibromyalgia.
Wow.
And I was like, no, I'm not having this. I can't accept all this. It was.
I like that as another take-home tool. When you guys get labeled, when you incredibly courageous, I call smart and sensitive TMSers, when you get a label, please question it. Just put it aside. Just put it aside and just realize that you're not your thoughts. You're not the label. The doctor is treating your symptoms. No, very few doctors treat you, and we're not here to bash them. It's just not their nature. So they're treating you, and you're a file, and you get a label, and then you get treated like the last person who came in the office. So understand that. Listen, I'm not against medicine. I'm sick. I take medicine. I'm just about being an educated patient, questioning, understanding, looking at things in perspective, because here are you getting told you have fibromyalgia and you're like, sorry, doc, I'm not buying it.
Yeah. And that's the thing, isn't it? If we take that label and live by that label, it can become part of us. It becomes our identity almost, and I'm not dissing or, putting anyone down if that has happened, because it's easy to do. We've been searching for so long to understand our symptoms. Someone gives you a label. It's like, here you go. Here's an understanding of it. We recognize it. It's almost like you feel validated because you've been given the label. But my Facebook group, I don't run that one anymore, but my original one was called Beyond the Label.
Beyond the Label.
I think we all need to live beyond that label.
Beyond the label. And on the other end, because I so understand all the shades of gray, the blacks and the whites, sometimes a label helps us, feels better. So there is pros and cons. Okay, so I have this. I'm not broken. I have this condition. My body's attacking itself. My chronic pain is neuroplastic. Let me just understand this and move on. So again, take it in perspective, put it in a place, but it doesn't mean, like a doctor said to me once, cancer doesn't mean it's a word. He said, cancer is a word.
Yeah. That's the thing, isn't it? All of it is word. All of it is just our language, a way of trying to make sense of something. And with our complex brains, they like to make heuristics. They like to have things in short form so that you can just go, it's one of those, or one of those. So having labels to put you in boxes helps the brain. So we feel more comfortable. We do naturally feel more, less anxious. We feel calmer if we are given a label, because it helps us to know where it is or what it is or what we need to do.
Right.
And so in some cases, as you say, it can really be a blessing. But if you then take that as your identity, that's where the problem comes, I think. It's like when it subsumes everything else. You're no longer someone who works in this field, or you're no longer a mum or an employee or whoever, all the other roles we fulfill. You become almost like, just, we say it a lot, don't we? Like And again, I don't want to be controversial, and it's not meant as a putting anybody
please be
down, but
be controversial, please.
But you see it with something like diabetes. Some people say they have diabetes, and it's just they have it. Other people are a diabetic.
Wow, interesting point.
If you see yourself as a diabetic, it's your whole life. It's your identity.
Wow.
If you have a diabetes, you can put it down sometimes.
And do you know also what Hanscom, and I didn't hear this, I didn't hear this from Schubiner, Schechter, or Clark. I didn't hear particularly this, but Hanscom will say it over and over again. Epilepsy, bipolar, depression are all like physiological states or inflammatory states. And I'm like, wow, this would change the whole medical system, the whole way we treat mental health.
Yeah, well, that's it. And that's why I started to come to, because I read Dave Clark's book, Dr. David Clark.
They can't listen.
A lovely man as well.
They can't find anything wrong with me.
Wrong. The Lovely Thin book, if you've not read it, it takes a matter of an hour to read it if you really wanted to just read it all. But he includes anxiety and depression in there. Not just physical symptoms.
In honor of Dr. Clark, and also this coming week is the big conference in America.
Yeah, the PPD.
The PPDA big conference where there'll be, I think Georgie will be there. I do want to say in honor, it's an incredible opportunity for anyone, for students, for therapists. I'm always promoting the PPDA. It's an incredible resource, but in honor of Dr. Clark, who's so amazing, you know what his advice is? His advice for every patient, and there's hundreds and hundreds of colons and irritable bowels and duodenoms and all these things and all sorts of toilet talk. He says it like it is. He tells his patients to please be a butterfly on the wall of your childhood. And in honor of all of our childhoods, my being a grandmother and a mother and understanding my own trauma and how I could have I traumatized my daughters, like understanding the intergenerational trauma, please take this advice. If you can be a butterfly on the wall of your childhood, it shows the relationship you potentially could have with your little child, which is so much part of the healing journey.
Yeah.
And it will just expedite your healing to be that compassionate, grateful, loving, and person who had to give up their authenticity to get love. And yet you're not there. Here you are in the present moment, and you could take that little girl, that little boy, integrate it into the present, and we know that from all the Eckhart Tolle work, how important it is just to be in the here and now. About the quantum work is that, our trauma is a memory. We have to heal the experience of the trauma, but the loving, amazing, strong person you are that got through that trauma, that surpassed that trauma, can be this little so the butterfly on the wall is such a powerful. Did you ever hear him say that?
Yes, yeah. And often on the Curable app as well, he'll just comment, would you want your child to live your childhood or something?
Oh my goodness.
That vein. And
whoa.
That's just like reflect. No. So yeah, definitely, his ideas of how to bring about that compassion for yourself have shaped how I practice. Definitely. I've trained with Dr. Paul Gilbert, professor, I think he is actually Paul Gilbert, and he founded the compassionate. I got to get it the right way around. The compassion focused therapy movement, and I was going to say compassionate mind, but that's Kristen and Kristen Neff in the US. No, but when he talks, he often says, about just imagine, like how it would be to go back there and see yourself, would you really, and that is that same butterfly on the wall, would you really want to intervene? As an adult, would you feel like intervening? Would you feel like standing up for that child? Would you want to say no more? Would you want to say, no, look after yourself. Let's go and sit down for a little while. And this is the thing, isn't it? We often don't reflect in that way, in that compassionate way, and see it for not for what it was, because that doesn't change, but for how it's affected us.
100%.
But not in the victim way. Again, it's like what it's as a way of going, okay, what can we learn from it? What can we do to change it for ourselves, but to change it for future generations as well? I talk to my son all the time now about, oh, can you remember that time I did that? I wish I hadn't. I wish we could have we could go back and how did that feel when I said that?
Change
you didn't go out and play, or that time I shouted because you dropped chocolate milkshake on the new carpet. It's like, but being able to forgive yourself as you learn as well. I think that's another take home that people could take. It's actually a big part. Forgiving others, but forgiving yourself as well for those times when you didn't know what you were doing. Again, it's not judgment, right or wrong, but
it's a chemical reaction. It's a softening. It's literally activating your vagus nerve. Just breathe and forgive and reflect. And these are all chemical behaviors, which you probably know as a cognitive behavior therapist. So I'm going to interrupt you like I do, and I apologize.
No, that's fine.
I want to bring us to the point of, so you're working, you quit your job, which was like stressful. I wanted you to mention that for a minute, because like that was a big thing. And for a lot of people, they might have to make a big life decision, which, might have to be a divorce. It might have to be to move on, but you had to leave a very big, important job, and you fought it for a while and your symptoms continued. And then you stopped the job and your symptoms changed. Was that correct?
Yes. Yeah. And it was twofold again. I don't think anything's ever just one thing. There's often multiple, things that come together to make, change, or to encourage us to change things. And one was my symptoms were still there, but these fibromyalgia symptoms were showing up in my hands and showing up at times when I needed to type. And in the NHS, as you're probably aware, a lot of your time is seeing patients, but a lot of the time it's also admin, writing up client notes, writing up reports, typing up meetings, all that sort of thing. And I was really getting these pains every time I sat at my desk. And then I noticed I was getting them even when I was thinking about going to type up my notes, which was really weird. But I didn't really recognize exactly what that was. I still thought there was another reason. And so I had some more tests. I was tested for arthritis, because I had Crohn's disease. And they thought, as another inflammatory disorder, autoimmune condition, it could be arthritis. But the tests came back, they weren't. And that's when I actually got the fibromyalgia diagnosis. But I was finding I was having to bring my computer home, my laptop home, and do my notes in the evening away from anybody else, because I was crying as I was trying to type because it hurt.
Wow.
And I was like, I can't carry on like this. This is a big part of my job, and I can't not type them, although they did offer to get a program to dictate into. It was like, no, there must be another way. But the other frustration that I was aware of was this mismatch in the NHS. And I always again, there's a bit of resistance. I don't want to beat up the NHS. They are a wonderful, wonderful institution. So many people wouldn't be here without them. So many people would have a lot worse lives without them. They are brilliant. However, they're not set up for TMS type work. They're not set up for chronic conditions. They are very well managed or very well set up for acute conditions, emergency medicine. Brilliant. But I was recognising, my IBS, my tinnitus I had at one point as well, TMJD, all these things I recognised then as TMS, mind body. They weren't necessarily physical issues. They were a mind and body issue. But I was working in psychological services, seeing people every day for their depression, anxiety, traumas, OCDs, and yet they all, just about all, probably a bit biased there, but a vast majority also had some form of chronic condition or something that we might class as TMS. They also had, had chronic pains. So it was like all these people I could help more. I've now done my training with Georgie. I now know what I'm doing. Yes, I'm still working through my own, but I could help them. But I wasn't allowed. I'm working in a system that doesn't allow me to practice the best I can. It's not a system that's allowing me to give the care that I could. I'm having to sit there doing one thing, thinking, I know that this other thing could help.
It's a major conflict, another major conflict you bumped into.
Conflict. It was a huge conflict on a daily basis. I was being very drawn into, like this rage again. And journaling wasn't just sorting it, it was there. It wasn't going anywhere. So a decision had to be made. And I set up my private practice, started doing that on, like part-time, cut my hours in the NHS, just to check out how it felt. And I was able to type up my notes in private practice.
Wow.
I was able to have those conversations that I needed to with people to say, have you thought that it might be more of a mind and body rather than just a mind thing? And, it was just like freeing. So
wow.
there are often
can I ask how you, like, there's so many people that we meet and that just, the pain scares them so much. Because again, pain does mean something is wrong, but not this kind of pain. This is counterintuitive. This is neuroplastic pain, and your body is in a protective mode, and you're living in a state of fight and flight, and there's a perceived threat. But how can we help people who are having so much pain in their stomach and so many symptoms, and how can we have them, because how can we have them stop and think that it's not just in your head, this problem is in your body, but the cause is in your brain. And how can we help them through the painful moments to stay at least in a place of, how can we help them, Tina?
Yeah. So I always think that the first stage is getting some data, because we are so driven with our prefrontal cortex, our thinking head. We like data. We can be a bit more objective if we're looking at data.
You mean evidence?
So gathering evidence, writing down, and I used to journal, I had pain today and I wasn't, or I wasn't working, but I was thinking about work. I had a tummy upset today because I was thinking about that food. It wasn't necessarily that I'd eaten it. It's like I still had it even when I was thinking about it. Or, I ate that food last week and I didn't have pain. So it's not that food that's causing this, gut issue. So just monitoring, but not to the extent, so it's, again, light touch, monitoring, looking for the differences, looking for times when the rule is broken. So
also a huge awareness of yourself, like to have this relationship with yourself, and this awareness of your patterns, what might be going on when things happen, like to in this loving, compassionate way, as opposed to in a fear mode. You're like in this, like, okay, let's just figure this out. Let's put this here, let's put this here, let's like understand. It's a clarity or this awareness.
That's it. It's having that curiosity, isn't it, to experiment a little bit, but safely. Curiosity. So I always talk to people, have curiosity, but I would say, like, look at things as experiments. All life is an experiment. We're all experiments. No one knows what the outcome is going to be for any of us. So we're all just trying different things. You're saying the best we can.
You're saying to be comfortable with uncertainty.
Oh, uncertainty. There's that word. I talk about uncertainty daily. Intolerance of uncertainty is what fuels a lot of our fear. Intolerance of uncertainty underlies most of the anxiety disorders. Like, again, a label, however, can be quite helpful, and a lot of TMS issues. And learning to recognize it for what it is, not believe it. Again,
it's a trust. It's a trust. It's a trust in yourself and a relationship. I keep using a relationship with yourself, to believe you're not broken, you're not a victim, you can get better. I always say, you're not so special that you can't get better. Your situation's not so special. You're a human.
That's it. If it's worked for other people, there's a good chance it could work for you. Try it. Try something. Try something different and see if it helps. If it doesn't, you haven't got to stick with it. We can try eating that that pizza that we keep avoiding, or try having or just recognizing whether we hurt when we do these things. If we have trouble sitting or walking, does it always hurt every time? Looking for the times the rules don't fit and making notes of it, because our brain will tell us, oh no, it's every time. It's not every time. Usually there are those times when it isn't happening. So having a journal or a notepad where you can go, oh yeah, actually there were a lot of times when it didn't happen. And then calming our anxiety in those moments. In IBS work, I'm always talking to people, about when they fear the flare. When you're fearing that flare up, that's your anxiety starting to cause the flare up. So actually intercepting right at the beginning of that cycle, as soon as you recognize, oh, I've got a cramp in my stomach, or I've got a sense of urgency, or I've got some indigestion, whatever your symptom is, as soon as you notice it, try diaphragmatic breathing. It's the quickest way to calm the whole system down. In for 4 and out for 6, nice slow through the nose. It will help to calm it down. You can then be more rational. You can then go, yeah, this is anxiety. I'm in this moment. And as Dan Siegel, Dr. Dan Siegel, another psychologist, psychotherapist, you come across Dan Siegel, he always say, name it to tame it. Name that emotion, so that then you're coming from the amygdala into the prefrontal cortex. You're giving it a rationale. It's a name, it's a label again. We can be beyond that label. We don't have to be the anxiety in that moment. Yeah. We can then watch it at a distance rather than be in it.
And I love, we could just talk hours and hours about people's thoughts, because that's what you're saying. We start to believe our thoughts, we become our thoughts, and we're not our thoughts. We are absolutely separate from our thoughts.
Yeah, thoughts are just clouds in the sky as they go across the sky. I know it's an old one, but it's the best thing still. I still see thoughts as clouds or leaves on the river, just floating by. Let them go. If we give them attention, that's when they get a hold.
So tell us more about some of the people that you've you've been able to help with some of these IBS symptoms, and how we can reach out to people in all of these Facebook pages and places that people that are not even thinking for a second. Though I think everybody understands colon and stomach issues. They have to understand there's something emotional, but how do we get them to stop and maybe just address and think that this is the way out? Because I'm meeting people and you're meeting people. I mean, I don't talk about it, but I've been diagnosed with Crohn's. I was diagnosed with a couple of, MRIs, and I was like you, like, oh, okay, that's an interesting thing. I don't think I have time for that right now.
Yeah, that's it. Yeah, and I think that's the thing, isn't it, as well? I've mentioned to you, I had a diagnosis of Crohn's as well, and I had asthma from a child, but all these labels are just labels. So recognizing that is huge. And I've lost my train of thought.
Good. That's because you're a human being. I'd like you to talk a little bit about your program, because you have a very nice, like, A to Z, a very good program. You're doing webinars now and groups. And what's special about your program? What are you doing? Are you just addressing colon issues or IBS, or you're seeing all sorts of clients? And what can you leave our listeners with, what they can put into their toolbox? I call it the Mary Poppins bag, and pull out today when they're most symptom, when they're most triggered. How can they take home some of these tools, and really, how can we help people on their healing journey?
Yeah, so I have a free Facebook group, which is IBS focused, and that's the Empowerment Circle, the IBS Empowerment Circle. I guess it's that I look at it from that holistic point of view. You asked a little while ago about, what it is, how I look at things differently. We've all been socialized into thinking of gut issues as a physical issue because it's called a gut issue. IBS was always called a functional gut issue.
Oh, wow.
But in 2018, it actually got reclassified, and it was changed from gut issue to a dysfunction of the gut-brain interaction.
Wow.
That's a big step in the right direction. It helps people to then start going, okay, there is the brain involved. There is something happening between the brain and the gut, and so making, more people aware of that, making people aware that, there is, we don't have to accept the medical model. It's a great model, but as I say, it's great for acute problems.
Right.
Once something turns chronic, look beyond the medical model.
Beautiful.
Of just, cause and effect, because nothing in life is that straightforward, is it? It's never usually just one thing that causes another. But always bearing in mind how to calm your symptoms.
So you're using a lot of meditation in your work.
I use meditation. I have something that I call the petal plan. We haven't spoken about that. That's my unique bespoke model that I work with. And the P stands for physical. So we always address the physical issues, and that would include our hydration and nutrition and sleep and rest and movement, as well as our physical pains and symptoms. We also look at the emotions, which is the E. The T is our thoughts. A is our actions, and that could be our worries, it could be our attention, or it could be what we avoid. And then I always make sure that people look at the loves and losses as well. So losses can be those traumas in their life, those times of chronic stress. But then the love is always making a plan for the future, looking at, living in a values-led manner, taking what you know, what you've learned, and building on it, and paying it forward as much as possible is what I usually try and help people to do. And I've help people to set up businesses, not necessarily in healthcare. one lady I worked with, she'd been, had difficulties for a long time, and at the end of therapy she was able to move on and set up her own business, offering I can't think what it was called. Oh, Coffee and Chat. I think it was just quite a simple title. No, Coffee and Conversation, that was it. Coffee and Conversation was her company she set up. And she started going to see older people or people who had chronic diseases or chronic conditions who couldn't get out and about.
Oh, amazing.
And she started doing it voluntarily to start with, and then just started charging, a small amount just to cover a amount for, to take some biscuits around, which was lovely because it meant she then had her purpose.
Beautiful. It reminds me of somebody that was on the show a year ago. He was on twice. Lovely man, Fred Amir, who wrote a book called I Might Be Tired. I'm tell you, rapid recovery. And he was amazing because he had horrible sciatica, like beyond asthma, allergies, beyond IBS, beyond, for no reason, but his childhood, his trauma, his drama. He was brought up in an Iranian family and they moved to California. Lovely man. But in his book, and I love this because this is another take-home tool for your Mary Poppins bag, he had a goal. He had a mission. Now, he also studied professional athletes who have a goal and a mission and a zone, like nothing stopping them. But for his goal, it was like he wanted to lift his 4-year-old daughter. And for a year and a half, he could not. And this was his goal. So when he had sciatica and he walked outside with pain going down his leg, and he knew it was going to get worse when he walked off the curb, he just was like, the higher vision was, I'm going to lift my daughter. And so the brain was like, oh, okay, I don't have to protect this guy. I can go be a brain. I'll put him into parasympathetic and he can be in rest and digest. I'm going to go be a brain and I'm going to stop this inflammation and this muscle tightness. This is how I kind of, dumb it down. But this is how he healed. So part of having a goal and a mission is chemical. This is the law of attraction. This is, I will get better. If you have to tattoo it on your arm or, write it in red lipstick in the bathroom window, you will heal. You can heal. You are healed. The Joe Dispenza work is to be the person, to act like the person.
Act as if.
Yeah. And so you've got to act as if you are healed and whatever that looks like.
Yeah. And that's it. And a lot of, like in CBT, a lot of depression work can be act as if, like, we know you don't feel like it, you're not motivated to do it, but act as if you are motivated. Go do it anyway and see what happens. And often people will come back and say, oh, I feel quite good now. I actually achieved that. Yeah, that's the thing. Often it's our brain that's just getting in the way. It's trying to protect us. Just the same as our symptoms are just there, trying to protect us from something that isn't really there. Yeah. It's not really something we have to be scared of. And once we get past that fear of the uncertainty of what it is, or if it is an issue, if it is something to be scared of, once we recognize it for what it really is, then it's easier to get past.
Yeah. Amazing. And so now today, 2024, September, what happens when you get a migraine?
I very often will say, what am I thinking about? What's happened? What am I worried about? What's going on in my life? Rather than, oh no, get me this sumatriptan. It's like, no, meditate, calm my whole system, journal. The last time I had a headache at the weekend though. That wasn't a migraine, but I'd been working too much and I recognized it straight away. It was like, actually, I'm going to cancel what I was going to do on Sunday and have a day of rest. And that's what happened. And the headache goes. Yeah. It's just like, sounds so simple when you say it like that, but takes ages getting there, doesn't it? But previously I'd have started with a headache and go, oh, it's a migraine. Oh my goodness, need to take tablets, need to go into the darkened room.
Yeah, for anyone who hasn't seen All the Rage, it's $5 still, and I'll promote it the rest of my career. It's only $5. Michael Galinsky, you can go on to alltherage.doc.com. You just text me and I'll send you the link. And Howard Stern is in it saying, after all these months of him healing and treating with Dr. Sarno, he's like, I'm laughing at the pain. I'm laughing at it. It does, and so many of my stories that I meet, ankylosing spondylitis, and this last one, these guys and these girls and these people decide to just say, come on, pain, you can't hurt me. So it's this relationship because of the great fear. And, there's nothing to fear but fear itself, is that they started to dance with the fear and realized that the pain was the fear.
Yeah. Yeah, and often it is fear, but as I said earlier, it can be other emotions there as well. It can be anger. We're told and socialized not to show anger, not to have anger, that anger is wrong. So that can be, there underneath as well, can't it? And that shame as well, which we don't always acknowledge. We don't always see it for what it is.
So true.
But that, there can be other emotions. And just learning about your emotions can really help as well, recognizing where each of them show up in your body, where, what happens when you're angry. Do your shoulders come up on your shoulder? Or is it, or are you someone that just holds it down and, like trying to hold it down, but your fists are there?
I mean, Rose would always say, when somebody had a leg pain, she'd be, who do you want to kick?
Oh, yeah. Yeah, that's it. Have you ever come across Yvette Rose?
No.
Yvette Rose, she, I've got her book, and Georgie actually put me onto that.
Yeah.
It's a big old volume, but it's metaphysical anatomy.
Yeah.
Go through all the body parts.
Well, you know who started it? Who started it? I have a little cheat sheet here. It's a book from Louise Hay. Yeah. Louise Hay started it because she'll have, and this book has every condition and tells you the probable cause of the condition and the new thought pattern, like what's happening, what's your thought. So, and part of that is, and there's many books now about, your body, like where in your body is it hurting?
But it's because the brain works on patterns, so it recognizes the words we use. So we say gut symptoms, or gut. I've got a gut feeling. That gut feeling is usually intuition of some sort. That's how we understand it. But why are we getting the gut feeling? That's an emotion. Beautiful. That's either excitement, it's getting all like ready to get excited, or it's scared of something. That's your gut feeling. So we've learned, like our language shows us what we feel as well. And the brain picks up on that pattern of language and produces the symptom.
Very important as well. Very important take home of some amazing tips here. So I can't write on the thing. Sometimes it shows up, sometimes it doesn't. So, but Tina Wright, your Facebook page is Evolve Psycho, isn't it?
Evolve Psychotherapy.
Right, psychotherapy.
Yeah. We all evolve.
Right. And you can always see it on, I'm going to put it on the TMS Roundtable page tonight or tomorrow. You can find Tina on Facebook, on Instagram, Evolve Psychotherapy.
Evolve with Tina on Instagram.
Yeah, and if you mention this this broadcast, you can maybe meet with Tina for like a little complimentary consult, find out if she can help you.
Connection call. Yeah, I offer a free 15-minute connection call.
Good.
Or, as I said to you, I've got a free guide as well, if anybody was interested to help reduce those flares, just
I love
a fast flare guide.
Will you send it to me? And I'm going to put it on I'm going to make a note to contact you to send the free guide, because I'd like to share it with some people. And thank you for that. Thank you for putting that together. So I am so happy to be talking about healing. I'm also happy to meet you and be part of your healing journey, and now be a colleague with you and a fellow healer. I couldn't have asked for just everything I wanted to ask got answered, and I might have some more questions, and you might have to come back because I love to follow up.
I'd love to. Yeah, I'd love to.
Yeah.
And yeah, it's just been wonderful. And anybody that does watch, any questions at all, just pop them in the comments, and we'll both come back to them and make sure that you get the answers you need, because that is part of that uncertainty as well. If we don't know the answers, that can fuel our pain. So
no, and it's
let us know.
And we've talked a lot about control and letting go, and part of it is a trusting and a letting go. And I always say the ultimate form of control is really a letting go, because then you're really in control. It's like the divine.
And you can relate that to the bowel.
Yeah, exactly.
Trust that you can let go.
Yeah, beautiful. So thank you so much. Bless your big, beautiful heart.
Thank you so much for having me.
And we'll meet again soon. All the best. God bless. See you next week.
Bye.
1 second. Okay, it's going to bring something up. I have to answer.